This is Stephanie Huff, and I am recording the concept of sensory perception. Looking at normal sensory perception is the process of receiving stimuli or data. The stimulus is either external or internal or both. Some of your external stimuli is visual, which is sight, auditory, which is hearing, olfactory, which is smell, tactile, which is touch, and gustatory, which is taste, and it can also be internal as well. Your internal stimuli is kinesthetic, which refers to the awareness of the position and movement of body parts. Example, a person walking is aware of which leg is moving forward. Stereogenesis is the ability to perceive and understand an object through touch, by size, shape, and texture. Example, a person holding a tennis ball is aware of its round shape, size, and soft surface without seeing it. Visceral means of or relating to a large organ within the body. Visceral organs may produce stimuli that makes an individual aware of them, like a full stomach. Sensory perception involves conscious organization and translation of the data or stimuli into meaningful information. For an individual to be aware of their surroundings, there are four aspects of sensory process that are needed. The first one is stimulus, which is an agent or act that stimulates a nerve receptor. The receptor is a nerve cell that acts as a receptor by connecting the stimulus to a nerve impulse. Most receptors are specific, which means they're sensitive to one type of stimuli: visual, auditory, or touch. Impulse conduction. Impulse travels along nerve pathways to the spinal cord or directly to the brain. Cranial nerves are important nerves that control many actions required for sensory perception. Perception, or awareness and interpretation of stimuli, takes place in the brain. Cranial nerves control many actions required for sensory perception. Awareness is the ability to perceive environmental stimuli and the body's reactions, and to respond appropriately through thought and action. Looking at alterations of sensory perception, it is common for many clients to have alterations to sensory perception, and they can affect clients and client care in a number of ways. Specific alterations are hearing impairment, cataracts, eye injury, glaucoma, and macular degeneration, which we'll talk about more in detail in the upcoming exemplars. Looking at alterations and manifestations, a number of nonspecific alterations may occur due to aging, genetic factors, or underlying illnesses. There are some nonspecific alterations in sensory perception. Vertigo is a feeling of rotation or imbalance. They may have nausea, nystagmus, which is just a back and forth rapid twitching of the eyes. A lot of times they may have difficulty keeping and maintaining their balance. Causes could be stroke, brain tumor, head trauma, could be a virus, or it could be idiopathic, which is just unknown. There is a benign positional vertigo that is probably the most common type of vertigo. It can be acute or chronic, but basically every time they move is when they get really dizzy and nauseated. There is what is called Meniere's disease, and it is a disorder of the inner ear that causes episodes in which you feel like you're spinning, like you would in vertigo, and you have fluctuating hearing loss with a progressive, ultimately permanent loss of hearing. They may have ringing in the ear, which is tinnitus, and sometimes a feeling of fullness or pressure in your ear. In most cases, Meniere's disease affects only one ear. Treatment of Meniere's disease or motion sickness medications such as meclizine or diazepam, which is Valium. They can reduce the spinning sensation and help control the nausea and vomiting. Anti-nausea medications such as promethazine might control nausea and vomiting during an episode of vertigo. Diuretics, diazide, which is triamterene hydrochlorothiazide, is used to reduce fluid buildup in the ear, thus treating the vertigo. Color blindness affects 1 in 10 men, rarely women. In color blindness, pigments are missing in the cones within the retina. Most common is that they can't distinguish red and green. Less common is being unable to distinguish blue and yellow. There is a achromatopsia, which is a rare form of color blindness in which they can't distinguish any colors. They only see shades of gray. Looking at impaired olfactory function. It is commonly associated with the common cold. It is also part of the normal aging process. Some medications, including antibiotics, cholesterol-lowering medications, can affect the sense of smell. Smokers have a decreased effect of smell. Radiation from head and neck cancer, brain tumors, Parkinson's disease, and MS can also be associated with decreased sense of smell. Taste disturbances are often overlooked. It is a normal part of aging. It is also associated with medication use, smoking, and infections. Gum disease can affect taste as well. Taste and smell are closely related, so they may share etiology. Decreased taste can also lead to weight loss, especially in your older adults. And so this is just looking at Meniere's disease, which we had talked about, and this shows you how they can get lots of extra fluid in that middle ear, but they are really having difficulty with lots of vertigo. All right, concepts related to sensory perception. Cognition includes mental assessment, the assessment interview, which looks at their cognition, and confusion. Alterations in sensory perception can cause confusion. Disorientation can be caused by sensory deprivation or sensory overload. So it's important as a nurse to assess function, sensory function, by obtaining a complete history and performing a physical exam. You want to pay close attention to mental status. Loss or decrease in one or more senses can mimic senility in older adults. You want to provide reorientation as needed and involve other members of the healthcare team if deficits are noted. In stress and coping, you're going to look at the types of stressors and the manifestations of stress. So loss of one or more senses can cause sensory overload as the other senses adapt to fill in the deficit. Client may become overwhelmed by loss of function and or sensory overload. Unresolved anger over the loss may impact relationships with others, especially immediate family members. So as a nurse, you want to note if the client looks bored or confused because the client may not communicate feelings over or underwhelmed. You want to eliminate extra noise and stimuli as needed. You want to provide meaningful interaction and stimulation to reduce emotional and physical isolation, and encourage them to verbalize positive and negative feelings related to their loss. Self, you're going to look at self-concept, self-esteem, and self-awareness. Alteration in one or more of the senses can cause loss of independence or dignity. As a nurse, you want to encourage verbalization of positive and negative feelings related to the loss, again, teaching the client how to adapt to sensory deficit, provide for client safety, encourage involvement with social and community groups to increase feelings of self-worth and contribution. You want to provide referrals to organizations that may assist with involvement and interaction, assess for the need for referral related to lack of transportation. In safety, considerations are across the lifespan. Sensory deficits may increase a client's risk of injury, especially falls and burns. And that's usually, especially with that tactile alterations. As a nurse, you want to assess the extent to which deficit impacts function, particularly safe movement. You want to assist the client to determine what coping mechanisms or assistive devices may promote safety. You want to educate the client, caregivers, about increased risk for injury and provide client teaching related to safety, and schedule an in-home safety assessment as necessary. An infection, complications of infectious diseases may lead to vision loss, hearing damage, and peripheral neuropathy. As a nurse, you want to provide client education regarding the needs to take antibiotics as prescribed. Provide the client teaching related to preventing infection, for example, hand washing, and treatment of illness that increase risk of for sensory deprivation is one of the best methods of prevention. All right, looking at genetic considerations and non-modifiable risk factors. Congenital hereditary conditions, they are at high risk for visual problems, retinopathy of prematurity, congenital cataracts, and fetal alcohol syndrome are related to decreases in vision. Premature infants, moms that are affected prenatally by rubella, toxoplasmosis, and other viruses, or who have certain congenital and hereditary conditions are at high risk for visual and or hearing problems. Auditory processing disorder is a condition in which individual has difficulty differentiating individual sounds into words. Child is born with it and there's an unknown cause. Looking at culture, it's often determines the amount of stimulation which is considered normal for them, and cultural care. So you just have to be aware of the different cultures out there. Stress and isolation can cause alterations due to being difficult, or due to being different and can't communicate as well. So a lot of times they are very stressed and they just put themselves in isolation. All right, illness. Medications, alternative awareness of environmental stimuli, atherosclerosis are all related to sensory deficits. Atherosclerosis restricts the blood flow to receptor organs and the brain. Uncontrolled hypertension can lead to vision loss. Strokes can also lead to vision and hearing changes, and smell and taste as well. Uncontrolled diabetes can lead to blindness. Maternal diabetes can cause hearing loss in infants. Repeated otitis media can cause permanent hearing loss in children. And this is a picture of lots of scarring to the tympanic membrane due to repeated ear infections, and that can actually cause them lots of decrease in hearing. And that is actually called tympanosclerosis, and that's the scarring of the tympanic membrane from repeated otitis media infections. All right, in prevention, some of your modifiable risk factors. Smoking can affect taste, smell. It can also affect vision because it constricts the blood vessels that go to the eyes. Ultraviolet light exposure, unprotected UV exposure can lead to serious eye problems. Short term, they can have irritation or photokeratitis, which is a corneal burn. Long term, they can develop cancers like melanoma, basal cell, and squamous cell carcinomas that can occur on the skin, around the eye, or in the eye. UV exposure increases the rate of cataract development and age-related macular degeneration. Premature infants in incubators, skip that. Medications like narcotics Sedatives can decrease their awareness of stimuli. Antidepressants alters their perception of stimuli as well. Stress, they can have sensory overload. Physical illness, pain, and hospitalization can all be related to stress. Isolation, this is when I was going to talk about the UV exposure. For premature infants, a lot of times they are in incubators and they're not touched as much, and that can lead to failure to thrive. And the same for older adults. There's been lots of studies done that if people do not interact and touch people and in a caring manner, then that can lead to failure to thrive. Injuries. Some eye injuries are minor and some are not. You want to treat all eye injuries as a medical emergency. There's lots of ear changes that are common in kids. Lacerations, infections, hematomas, foreign body stuck in their ears, insects being in the ears, can have blows to the ears, ruptured tympanic membranes. Screenings. For hearing, most infants are screened before leaving the hospital. Preschoolers and school-age children undergo periodic screening at school and in the healthcare provider's office. Early detection is critical. Adults are screened at least every 10 years until the age of 50, and then it changes to every 3 years. Vision between the ages of 3 and 5 receive vision screenings at least once. Beyond the age of 40, 1 in 28 people in the United States have some type of visual impairment. They recommend annual or biannual screenings. Taste, smell, and touch. There's no current recommendations for screenings. Most are found when the patient presents to the healthcare provider's office with complaints of alterations in these areas. Looking at the assessment, there are 6 components to assessment of sensory perceptual functioning. It's going to start with the nursing history, mental status examination, identification of clients at risk, assessing the client's environment, providing social support network, and a good physical assessment. Looking at the nursing assessment, you want to obtain a thorough history from the client. You want to assess their current sensory function, any sensory deficits they have, any recent changes, their noise exposure. You want to assess for chronic diseases or illness and medications that are taken. In the client environment, you want to assess for quality, quantity, and type of stimuli. Inadequate environment stimuli places them at risk for sensory deprivation, and excessive stimuli may increase their risk for sensory overload. Social support network, you want to assess whether the client lives alone, who visits and when, and any signs indicating social deprivation. In the physical assessment, visual acuity is done with a Snellen chart, which is where they stand 20 feet from the chart and read the smallest line with or without corrective lenses. Is recorded such as 20/20. And so basically, if they are like at a 20/40, they can read at 20 feet. They can only read at the 40, where most people would read that at 20 feet. So the further you go down, the worse their vision is. So the increase in numbers, the worse the vision. All right, hearing acuity. You want to observe patients' conversations with others as they're as they're talking to them, do they turn their ear? Do they hold their hand over their ear to try to get more sound in? You can also do the whisper test and Weber and Rhine test using the tuning fork. Olfactory sense, you want to identify specific aromas. A lot of times they'll have them close one nair and breathe in a common smell and then repeat it on the opposite side. Your gustatory sense, identify 3 tastes such as lemon, salt, and sugar. Tactile sense, testing light touch, sharp and dull sensations, 2-point discrimination. Hot and cold sensation, vibration sense, position sense, and stereognosis. Your taste, smell, and tactile assessment often is not adequately tested. You do want to also inspect the mucous membranes to see if they are moist, are they dry. Test with familiar smells. Eye and vision assessment include the assessment of their vision, which we talked about. Visual acuity being assessed with eye charts such as a Snellen chart or an E-chart for distant vision. Those E-charts are used when people can't, maybe they don't speak the English language or they don't know the letters of the alphabet, so you can use an E-chart and they just have to do the position that the E is in. There is also a Rosenbahn chart looking at near vision. In the Rosenbahn chart, it is held at 12 to 14 inches away from them. When you're assessing eye movements, you're doing the 6 cardinal fields of vision. Pupils, you want to make sure that they are equal and reactive to light and accommodation. You want to assess the external eye for any abnormal findings. The internal eye, this is when the ophthalmoscope is used to visualize the lens, vitreous humor, and the retina. And so this is looking at the 6 cardinal fields of vision. And so basically, you move your finger, or you can put a pen in your hand and have them follow that in all these 6 levels. Ear and hearing assessment includes assessment of hearing using the whisper test. And if it is abnormal, then they will use the tuning fork test, and that's your Weber and Rhine test. You want to assess the external ears. They should be equal in size without palpable lesions. An otoscope is used to inspect the external canal and the tympanic membrane. External canal should be pink and smooth without lesions. Serum is expected, but the amount present should not interfere with the exam or have a foul smell to it. The tympanic membrane should be shiny and translucent and a pearly gray in color. Should have well-defined cone of light, which is known as the light reflex. Should also be visible on the tympanic membrane. Cranial nerve assessment includes smell. Talks about including 1 nair and repeating it on the opposite side after that one's complete. But they should close their eyes and identify a familiar smell such as vanilla, coffee, alcohol prep. Tactile sensation, you're looking at, can they differentiate between sharp and dull objects? Touch the skin in various spots, and they should be able to tell you where you're touching them. They should be able to tell you whether something's warm or cold. Kinesthesia is a position sense, also numbness and tingling. Ability to discriminate fine touch. That would be 2-point discrimination, so you're touching them with 2 different things and you're moving them closer and closer together till they think that it's just one thing. Any difficulty in touch. You also want to assess both sides of the body and touch both sides, and they should be able to tell you which side is being touched. Taste alterations are usually found when they seek help at the healthcare provider's office for a decreased taste. These are your 12 cranial nerves, and so this just kind of shows you how to assess each nerve, which is always very important to know. And just if you see this, 3, 4, and 6, those are all looking at eye muscles. And so an easy way to remember that is 3, 4, and 6 makes your eyes do tricks. Other diagnostic tests may be necessary to diagnose specific injury or disease processes. Some of the examples are retinoscopy, which is looking at the retina, and these are all different. On the right, these are different retinoscopes that can be used. Refractometry is to diagnose refractory errors in the eye that require corrective lenses. Which is that bottom right one. The top right one is your retinoscopy. Your auditometry is to evaluate the extent of hearing impairment, and so that's an example of that on the bottom left. Interventions and therapies. Care of clients with impaired sensory perception includes collaborative and independent interventions. The independent interventions are going to focus on education, injury prevention, and wellness promotion. Collaboration will focus on facilitating medical management of patients' condition, interacting with the healthcare team to optimize client outcomes. Looking at independent and more detail, promoting healthy sensory function is needed. The environmental stimuli is also needed in the environment to provide appropriate sensory input that's not excessive or too limited. Routine auditory testing of children is important. Chronic ear infections lead to scarring, which can lead to decreased hearing. Noisy environment can also lead to decreased hearing. We'll talk more about this when we talk about hearing impairment. Your environmental stimuli needs to be adjusted as necessary so they're not getting too much or too little. Teaching clients how to prevent and reduce loss. That could be like controlling chronic diseases like diabetes, avoiding known risk factors. Some more independent interventions. Preventing sensory overload. For those at risk for overstimulation, you want to assist with reducing the number and type of stimuli. You want to reduce novelty and surprise interruptions. Explain sounds in the environment like IV pump alarms. You also want to encourage earplugs if they are in an environment where there's lots of noise to protect their ears. Also encouraging them to use dark glasses with UV protection that protects against UVA rays as well as UVB rays. Preventing sensory deprivation, you want to provide reading material such as newspapers, books. Also let them watch television or listen to music. Objects for soothing touch such as soft fabrics, let them be able to touch on those. Schedule visitors at regular intervals. There are clocks that use color so that they can differentiate between day and night, which is very helpful, especially if they're in a room that does not have an outside window. Fresh flowers, if they are permitted, to stimulate their smell. You want to manage acute sensory deficits. Encourage the use of sensory aids to support residual sensory function. And so visual, a lot of times they can have service dogs to help them, braille, reading material, or they can do audio reading, or have the readings put on audio so that they can listen to them. They may be able to use a magnifying glass. The use of sunglasses to help protect their eyes. Clocks with large numbers, make them easier to read. Hearing, lip reading may be important. Sign language, Flashing smoke detectors and alarm clocks will help. You want to promote the use of other senses. A lot of times they end up getting stronger when one is decreased or absent. Communicate effectively. So clients with visual, they may like music performances. They also can have information converted to audio, like we talked about. People with hearing deficits, they can communicate via email or text if they are not able to use the phone and hear on the phone. Things that you can do for people with visual impairment is to announce your presence when you enter the room. Use a warm, pleasant tone. Make sure that you tell them what you're going to do before you touch them. For hearing deficit individuals, you want to face the patient. You want to decrease background noise such as TVs before speaking. Talk at a moderate rate. Don't over-articulate and don't talk with gum or anything in your mouth. You want to speak clearly. Use longer phrases. They're usually easier to understand. And then just making sure that you're considering safety as a factor as well. All right, in promoting effective coping, moderate to severe sensory deficits impact the patient's quality of life. Looking at impaired vision, these are going to be features of a safe environment, uncluttered environment with plenty of lighting. You want to clear pathways. Furniture should not be rearranged without orienting the patient, but making sure that chairs are pushed back up under tables, other articles are put away so that they don't trip. You want to organize self-care articles within their reach. Orient the client to a new location when traveling or running errands. You want to keep the call light and assistive devices within easy reach of them. Assist them with ambulation by standing at the patient's side, walking 1 foot ahead of them, allowing them to grasp your arm as needed, and that will just be individualized to what the patient is used to and what is easier for them. You want to increase risk of depression, or excuse me, there is an increased risk of depression in older adults, especially with impaired vision, so you want to address that as well. For those with impaired hearing, they are going to need to be assessed frequently. In their home environment, they may need devices to help amplify sounds and flashing lights. Some of these can be obtained from hearing aid dealers, telephone companies, appliance stores. There's also closed caption TV so that they can read what is being said. Impaired olfactory sense. Dangers of cleaning with chemicals like ammonia may affect the patient well before they are smelled. Gas leaks can go undetected, so they need to keep gas stoves and heaters in good working order. Food poisoning is a problem, so they need to inspect the food for color and texture and expiration dates because they may not be able to smell that the food has gone bad. Impaired tactile sense. They may be unaware of hot temperatures, so a lot of times they need to adjust their hot water heaters so that they don't get as hot. They need to test the water temperature with a thermometer before taking a bath. Sometimes they have decreased sensation of pressure, so they need to change positions frequently. Impaired hearing. Which we've kind of talked about already as far as impaired olfactory sense and impaired tactile sense. We have already discussed those as well. Collaborative pharmacologic therapy. Your treatment is going to be based on the cause and the severity of the alteration. The eyes are vulnerable to many conditions. They may be preventable, controlled, or reversed. Glaucoma is controllable with medications, the use of anti-glaucoma drugs. We'll talk about glaucoma later in the exemplar. Macular degeneration can be slowed with medications as well. Olfactory impairment may be resolved by treating the underlying cause, which could be diabetes, hypertension, Parkinson's disease. Permanent hearing loss and alterations in taste and smell have no meds to treat those. All right, so that's the end of this lecture. And again, as always, if you have questions, let me know and I will try to help clarify.